morning.
Good morning.
As an oncology nurse at Eastern Maine back in the dark ages, I saw firsthand what affordability meant for my patients. For example, as oncology care moved from very expensive hospital admissions to more affordable and accessible ambulatory settings, survival rates doubled, and then they tripled. Our author, T.R. Reid, makes his point about affordability when he discusses Nikki. Nikki died at the age of 32 of the complications of lupus. As he very simply put it, if Nikki had lived in any other of the world's rich countries, she would be alive today. While covering Nikki's history, I will also look at how she would have fared under the current ACA. Lupus, an autoimmune disease, cannot be cured, but it can be controlled, much like diabetes, for example. So when in her 20s, Nikki began to feel ill and discovered she had the diagnosis, she took a job at a hospital where she was eligible for the health plan. Then she became too ill to work and she had to leave that job. Like most Americans, she lost her health insurance when she lost her job. Unemployed and uninsured, she moved back with her parents in Tennessee, where she joined TennCare. That's like our Maine Care, the state's Medicaid program. But in 2005, that state had cut back sharply on the funding for the plan. Nikki had needed the coverage to pay for regular blood tests, CT scans, and office visits. These were necessary in order to monitor the medications she was taking. She spent the last months of her life filling out forms one after another. By the time she learned that Medicaid would cover her if she could be declared disabled, her hands were so painful she had to wear thick gloves in order to write. She suffered a seizure due to kidney failure, a long-term complication of the disease, and was admitted to the emergency department. There, federal law decreed that she had to be treated until she was stable. During the last 10 weeks of her life, she had more than 25 operations, gratis, but by then she was too sick to save. Officially, Nikki died of the complications of lupus, but Reid reports her cause of death to be a healthcare system that failed to provide the treatment that could have saved her life. He emphasizes the importance of research, of preventive care, and of regular timely care, all major components of a healthy healthcare system. Research programs often lead to success. In oncology, on my watch, we saw, for example, for the first time really, how various cancers were linked to lifestyle choices, for example, smoking and diet, and pollutants such as asbestos. We saw how public policy and programs changed their impact on the population. Preventive care can help a patient not only to survive, but to maintain a quality of life. It was not available to Nikki at that time, but we know it can promote health and greater longevity. Our own Senator Angus King has told many audiences how important it is, or it was in his life. For those of you who don't know, at the age of 29, he was encouraged by his new employer to get a checkup on his new insurance plan. Melanoma was discovered, but because it was diagnosed very early, he was able to be treated and to survive. Timely care, carefully planned, turns out to be much less costly, both for the patient and for the taxpayers. Under the ACA, Nikki's diagnosis would have been considered a chronic condition. According to the CDC, 75% of the $2.5 trillion spent annually on health care is spent on chronic care. And in fact, 50% of adults in the United States live with a chronic condition. And I'm almost at the end here. The ACA is currently putting in place various plans and strategies designed to deal with the ongoing results of chronic conditions. For example, new reimbursement systems, also expanded nurse-managed health centers, increased use and accessibility of NPs, and greater emphasis on patient education. And these are only a few. Nikki's 25 surgeries at the end of her life were obviously a great expense. The blood tests, CT scans, and office checkups, if she had received them, would have been a good deal cheaper and would have kept her alive. Under the provisions of the ACA and in Tennessee with its Medicaid expansion, she would have had access to them. Nikki's journey through our healthcare system was not unlike that of many others. Unfortunately, it is one more example of its failure.
You've heard the story of Nikki. She was a resident of the U.S. What would have happened to Nikki if she had lived in another country? If she lived in another first world country, she would have received the treatment she needed to continue to live. We have a few representatives here today, and I'm asking them, if you have a flag in your lap, to come on up here. Unfurl your flags, and we'll help the people identify which country you have. And when we line up, let's just go right that way, okay? We have representatives from Canada, France, the UK, Japan, the US, Germany, and Taiwan. Got that? These representatives will line up in an order from left to right. So this will be number 1, and that will be number last, okay? And they're going to go right across like that, okay? And the first lineup that we're going to have will be with respect to life expectancy. The country over here, you can start to organize yourselves, will be the one with the longest life expectancy. And the one over there will be the one with the lowest life expectancy. Oh, I see the United States is moving down to last place over there, okay? And the difference between the first and the last is 4.5 years. You want to hold your flags up a little bit so people behind you see who you are as well. Okay, excellent. Now I'd like the countries to line up with respect to infant mortality. The one over here will have the lowest. The one over there will have the highest. Move down, buddy. The range is from 2 to 6 deaths per 1,000 births. What about avoidable mortality? Nikki's death is an example of that. The study looked at how many people in each country who contracted a potentially fatal but treatable medical condition were treated successfully and survived. France is first.
Vive la France!
Excuse me, the United States is 15th. Further. There you go. Okay, buddy, you got it now. Finally, what about expenditure on healthcare as a percentage of GDP? The first country, United States, you're moving up here, spent 18%. The lowest spent 7%. And the countries in between, 10 or 11%. Look who's first now, with respect to cost, of course. How do the countries we watched here bring about their accomplishments? After the offertory, we'll look at a few of them.
Thank you, countries.